Onicha, our guest speaker for tonight. God bless you. Okay. Good evening. I know everybody is still eating, still getting refreshments, and I'm personally happy to see that because it's not necessarily easy to speak to a hungry audience. As you're speaking, but on a serious note, I'm very, very honored to be here. I'm very personally honored by the invitation. My assignment has been to try and inspire the evening. And I'll say that the reverse has already happened. I'm personally inspired by what I've seen, particularly by the children. We all know how difficult it can be to get our children to do what we just saw. So I live inspired by that. I cannot go too far without introducing myself. I am Dr. Onicha. I'm an orthopedic surgeon. I practice here in Maryland, also next door in Washington, D.C., also next state in Virginia, also across in our homeland in Lagos, and also in Alibo in Owerri. So I have a practice that's active doing orthopedic surgery in all those areas. So this particular Onicha Amiri project is relevant to some of the experiences I hope to share with you today. So how did I end up here? On a personal note, Dr. Chilea Hagotu, who is a senior colleague of mine and the Vice President of Medical Affairs, very, very well-respected, very accomplished doctor obviously from Onicha, invited me to speak here. He was the one initially to do the address, and he had a conflict. So he asked me, and I said, well, what do you want me to do? What should I say? What's the topic? And he said, no, it's very simple. Just anything you feel like saying, just make sure it's inspirational. So that was the assignment. I said, well, the assignment is to inspire. So I promised to try my best. And let me start off by saying what I do. Again, I'm an orthopedic surgeon. I'm with the Georgetown MedStar medical system here in the DMV. I practice hip and knee replacement surgeries. That's my specialty. I get called upon mostly for what they say is the complex hip and knee replacements, those that in some cases have failed, that need to be redone, or for whatever reason it's more complicated than expected. So that's my specialty. Furthermore, I have the hospital in Nigeria. I founded 2 boutique surgical hospitals. They are called CAS, Center for Advanced Specialty Surgery. One is in Lagos and the other is in Owerri. In those hospital practices, we do the same surgeries I do here. And it started off from nothing to where we are. We also started a non-profit foundation called Operation Stand, Walk, Run. We do operations to help people who cannot stand to stand, who cannot walk to walk, and who cannot run to run. We also have a political activism group for young people in Nigeria. Thank you. It's called the Organization for Impact and Reform. That organization we started because we recognize that it's impossible to do the work we want to do without good governance. And so as much as we have communities like this that consistently try to do what we can individually or as a community, the negligence from government continues to be the biggest reason that we are where we are. So we wanted to inspire the government by inspiring our young people to get involved and organize themselves to play a role. We also have an organization called Niger 911. That's a technology platform that we're setting up. You'll probably hear from it soon. That's a way for people to reach specialty care in emergency situations. Niger 911, coming soon. I was the former president of the Association of Nigerian Physicians in America, the largest collection of doctors outside Nigeria. We hosted a convention here in the DMV a couple of years ago, and it's very impressive to see how many Nigerian doctors are actually practicing here in the US. So that's sort of what's on my plate in brief. Let me just tell you a little bit about my own personal journey and how I ended up where I am. I started my education in Enugu. I went to Ekulu Primary School. Some people here may have gone to the same school. When shortly after Imo State was created, my family moved to Owerri. So from there I went to Shell Camp. I finished my primary school at Shell Camp Owerri. As I was finishing primary school, we had to take Federal Common Entrance. And one of the biggest accomplishments was that I finished number 2 in all of Imo State in Federal Common Entrance. Now, I've been saying that not to brag. I honestly not trying to brag, but for me it was an important anecdote which I will explain in a little bit. So I went to Federal Government College Okigwe. In those days, the Federal Government Colleges attracted people from all parts of Nigeria. So at a young age, some of my friends were from other parts of Imo State, parts of Igbo land, from Calabar, Akwa Ibom, from the north, from the west. And even as small children then, we got to appreciate that even though we are different in some ways, we are similar in other ways. And so I've always had that recognition that as black people anywhere in the world, there are more things that pull us together than pull us apart. And I cling on to that belief. From Okigwe, I came to the United States. As I was leaving Nigeria and coming to the US, my mom, who had spent some time in the US, told me something that resonates till tomorrow. And she said, "You're going to America. You're a black man. Any room you walk into, most people are going to look at you as not quite good enough as a black person. From that position, you have to demonstrate excellence for them to appreciate that you're good. On the other hand, a white person walks into the same room and they are given the benefit of the due benefit of being good, and it's only when they screw up that they are seen as being mediocre." And so, as I came off the plane, any room I walked into, I had that in mind. And that's unfortunately true, not just for white people, but even other black people. Sometimes as a doctor, I can see the doubt in their face that, is this the person who's going to operate on me? So I've always had to demonstrate excellence because that's what convinced my colleagues, my patients, and others around me that they could trust their family members in my hands. And that's what I teach my own children, to try to be excellent in everything they do. So from Okigwe, I went to Penn State. Penn State in those days was a big school, still a big school. And there weren't that many of us from Nigeria. So I had to draw friendships with other black people from Jamaica, from Trinidad, from other parts of Africa. And again, I started seeing commonalities, that we have a lot of similarities with other people from other parts of the world. After that, my education took me to University of Pennsylvania, and then to Rutgers, and then from there to Washington, D.C. here, where I did a residency at Howard. I see your sister, Mrs. Alice Ukewu, was my colleague at Howard. And so that's how I did my specialization. During that period, I was doing orthopedics. I started traveling back to Nigeria, trying to see how my education here would benefit people in Nigeria. Because it was an era still in the 90s, the 90s and early 2000s, where we still had the expectation that we would go back to Nigeria. So that's how I decided to do hip and knee replacement surgery, because it was a specialty that was lacking in Nigeria. I subsequently finished my fellowship training, and I started going to Nigeria as I had promised, but I could not make money in Nigeria at the time, or so it seemed. So I was doing mostly charity work. I had the privilege of doing the first knee replacement surgery in Imo State, in Olo Teaching Hospital. And the first knee replacement surgery in many other states. In the interest of time, I will not mention that. But I recognized that that charity work was only helping 1 or 2 people at a time, not a systematic impact. And so instead of talking to government, governors, ministers, anybody whose audience we could get. And unfortunately, what we started seeing is that the government did not really have the sincerity to help develop projects. And that's how we started our own hospital. Prior to that, we will see, as the chairman had mentioned, there are many people who have money who will come to the US to have their surgery, those who have money, those who are wealthy, but the masses could not. And so we decided to set up our hospital in Nigeria. That hospital started from nothing, just like this Onicha Amiri Hospital is. When we started, we had very little in place. I will say to you that we started with that project. We subsequently started teaching others how to do the same work that we do. And we looked at our numbers recently. The hospital has done about 300 hip and knee replacements. We haven't had any complications. We've been able to give people the same results that we give here. So let me just quickly wrap up. I see that we're running short on time. I would say any vision starts with just that, a dream. That's how we started. From there, one has to have a plan. You have to have a plan that's achievable. With that plan, you have to have discipline to achieve it. Discipline to me means that you are always tempted to, on a daily basis, there's something you feel like doing that you don't want to do, and there's something that you should be doing that you don't feel like doing, and you have to consistently do that. It's difficult to be here in the US and see how well things work and replicate that in Nigeria. So you have to have a good team, you have to have consistency, you have to have leadership. I can go into more depth with all of these principles that has allowed us to have a hospital project in Nigeria that is running, that is achieving good results, that's helping people, and then subsequently expand to a second location in Owerri. All of that is still possible for this project here. And I'm happy to see that India Onicha have embraced this very important project. I'm happy to be your keynote speaker and inspire everybody based on my own personal journey to demonstrate that it is possible, it is achievable, and I can already see it. I'm happy to be part of that vision, and I thank you again for inviting me.